So, according to receptor occupancy theory, this theory explained concept of agonist and concept of antagonist, competitive antagonist. And number three, this receptor occupancy theory given by Clark, known as Clark theory. This Clark and Gatum explained or introduced concept of antagonist, competitive antagonist, and they described this parallel shift. They described parallel shift of log concentration versus effect curve. The agonist, competitive antagonist, and Clark, along with Gadam, they explain competitive antagonist in low concentration versus effect curve and the parallel shift of the curve. So, according to this receptor occupancy theory, the postulate of this theory, number one, magnitude of response. Magnitude of response, this is also known as pharmacological effect. Pharmacological effect is directly proportional to number of receptors. Directly proportional to number of receptors. And this number of receptors occupancy, it depends on dose of the drug. These are receptor and this is the dose of the drug. So number of receptor occupancy depends on the dose of the drug and number two, total number of receptors. Total number of receptors. So magnitude of response is directly proportional to the number of receptor occupancy, and that is depend on dose of the drug and total number of receptors. And this gives a linear curve. That is, these are the receptors and this is the occupancy. 0%, 50 and 100%. Here the response is 100% when all the here two receptors are occupied. So 50% receptor. This is the receptor occupancy in percentage. So out of suppose 4, out of 4, 2 receptor, 50% receptor occupied, so response is 50%. At this place, all the 4 receptor are occupied. All the 4 receptor are occupied. So receptor response is 100%. So as we increase the number of receptor occupied, the response, magnitude of response also increases. So at 100%, there is 100% response. So this theory explained two extreme, this and this, and this was known as all or none action. All means when all receptors are occupied. All receptors are occupied. That is 100% occupancy. Then response will be 100%. None means zero at this plate. Suppose these are the receptor on the cell. This is the cell and these are the receptors. Receptor response will be 0%. This all is known as agonist, is known as antagonist. Between there is no partial agonist. There is no partial agonist. So the limit of this theory was agonist. This was not explained by this theory. Second thing, spare receptors. Concept of spare receptor not explained by this theory. Third, affinity, that is potency. Fourth, intrinsic activity. So these are the four limitations of receptor occupancy theory. Four limitations are explained by the modified receptor occupancy theory. So modified occupancy theory, it explained two terms, affinity, number two, intrinsic activity. Affinity is explained in terms of potency. Potency means drug with high affinity are more potent. Drug with low affinity are less potent. And intrinsic activity explained in terms of efficacy. Efficacy means high intrinsic activity means maximum efficacy. And if there is low intrinsic activity, it means low efficacy. Low efficacy. So if these are the two A, B, and C. In this case, A is more potent than B because A gives 100% effect at dose 1 mg and B gives same 100% effect at 5 mg. Suppose A is the cetirizine and B is the levocetirizine, and C and B, height of the curve, B is having more efficacy than C. More efficacy than C. The most important thing is potency and efficacy. They are independent. They are independent of each other. These two terms are independent of each other. So according to this theory, magnitude of response. Magnitude of response is directly to number of receptor occupied. Number two, also there is activation of receptor. There is activation of receptor. That is intrinsic activity. Intrinsic activity. So according to Clark, according to Clark, receptor, this is the receptor occupancy, and here is the response. 0, 50, and 100. The relationship between response and the receptor occupancy is linear, is directly proportional according to Clark theory. According to Arians, Arians gave concept of intrinsic activity, that is alpha. The relationship is also linear, but it is lower than this because of alpha. Suppose here alpha is 0.4, that is 40%. So the drug which have intrinsic activity 1, they are full agonist. Intrinsic 0, they are antagonist. And in between, they are partial agonist. They are partial agonist. Then, according to Stephenson, Stephenson introduced the concept of efficacy, and this curve is hyperbola. So, Clark theory, then modification given by Arians and Stephenson. Stephenson. Arians gave the concept of IA, intrinsic activity, and Stephenson gave the concept of efficacy. And Clark theory gave concept of full agonist and competitive antagonist. So this is the receptor occupancy theory, and these two give modified receptor occupancy theory, also known as Arians-Stephenson theory. So receptor occupancy and modified receptor occupancy, they are known as CAST theory, CAS theory. That is Clark, Arians, Stephenson theory. Next we'll see rate theory and two-state theory.